parents are going to go to New York City. Tell me a little bit about that.
You know, I have a strong background in ICU, and I have the job flexibility. I'm single, I'm young, I don't have a family here. And I was contacted by a couple recruiters, and I said, yeah, sure, you know, sign me up. I can commit to 4 weeks.
Wow.
So yeah, trying to you know, be back in time for finals and wrapping up the semester, of course, being able to focus on that. So you know, I feel like I can definitely commit to 4 weeks.
I would imagine in your role there, are you foreseeing that many of your patients may not make it and you will have to deal with end of life issues? Tell me about that.
Absolutely. That was probably the defining part in my decision, I guess, because, you know, I gave it a good bit of thought before committing. But again, that's why I went back to school to further my education, is for end of life care, for being there, providing dignity in the form of just being there at patients' last moments. So yeah, I'm not really going there to sort of like save all these patients, although that would be awesome.
Sure.
My sole driving factor is to be there when patients are alone and they are dying.
Wow.
Yeah.
That, to me, that is one of the most important things a nurse can do. And I know you're going to be working in very difficult circumstances. I know that families, for example, aren't allowed in to many care settings now. I'm facing that myself. I have a family member in a care setting, and I'm no longer able to enter it. Maybe talk a little bit about what is that gonna to be like when families can't be with their loved ones who are passing away.
Yeah, I mean, that's the single hardest thing, being in the ICU and having patients die alone has unfortunately been a part of my ICU experience, and so I try to avoid that as much as possible. If I'm the only one that can be there in the room with them, then I absolutely will. Because having a patient die alone is probably the worst thing. I know some nurses, I've heard some nurses are able to call the family member on the cell phone in a bag to sort of limit the infection and everything that's going on. But hearing seems to be one of the last things we hold on to. So even if a patient is on some sedation, they can still hear their family member talking to them over the phone. So, you know, if I can be that person holding the phone, then absolutely, you know. But if you know, if it God willing doesn't hit as bad here in San Diego, and I can go help in New Orleans after I get back from New York and I'm still healthy, God willing, and then absolutely I can you know, commit to a couple weeks there as well. Yep.
Well, Elena, if there's anything we can ever do for you at our school, please let me or Dr. McCauley know. We just have enormous respect that you're doing this. And I've just never been so proud to be a nurse as I am in 2020. American nursing is really stepping up and are the true heroes. So thank you so much.